Many patients think that it's a slam dunk. It's an automatic guaranteed pregnancy. But truth be told, if someone has a long-standing history of infertility, there's probably some underlying pathology that's been going on for a while, and something's going awry in the process. Sometimes we learn that despite having very good numbers, meaning egg count on ultrasound, anti-Mullerian hormone on blood work, or a young age, or normal semen parameters, that by the time that these eggs and sperm make it to the laboratory, there's some intrinsic egg dysfunction or sperm dysfunction. Even though we can control as much as we can in the laboratory, there's some things that are out of our control. And those things are the genetics. In plain English, the most beautiful embryo can be chromosomally abnormal. And if that embryo is abnormal, that can lead to a child with disabilities, things like Down syndrome, for example. That's the common one that people know about. Or it can lead to a terrible miscarriage. Patients often ask, my friend had 4 transfers done in another clinic and none of them stuck. Do you know why? And I would tell them no, because getting an embryo to stick or implant can be the uterus, which is where you're putting the embryo back, how you're putting the embryo back, the environment you're putting it back in, how you grow the lining of the patient. But more importantly is, what do those embryos look like? How did they perform? What was their chromosomal status? All these data points help us guide patients along their way.
After the embryos develop and at least one is deemed viable, it is time to prepare the uterus for transfer.
So after your retrieval, of course, the next question is, when am I going to have my transfer? So ideally, we like to wait until we know that we have normal embryos to transfer, unless, of course, you're having a fresh transfer. Otherwise, you would contact us with your period and we would talk about your protocol. We would either put you on a birth control pill to allow us to have timing, a drug called Lupron, which also allows for timing and prevents ovulation. So we have complete control of preparing your lining for the transfer. So depending on what the protocol is, we review that in detail with you, order your medications. Again, make sure every consent is